In this video, you are going to learn how to do arthrokinematic assessment and treatment for the dorsal capsule of the radiocarpal joint. Hi and welcome back to Physiotutors. The aim of roll-glide assessment is to gain information on the reactivity of the joint and articular problems such as capsular limitations. For the pull technique, have your patient in sitting position with the shoulder and elbow in MLPP and the elbow in pronation. The patient places the elbow on the slightly lifted head part of the bench so that the wrist is hanging freely. Then fixate the patient's forearm on the bench and grab the patient's proximal intercarpal row from dorsal and embrace the intercarpals with your thumb and index finger on the palmar side. The intercarpals are the convex joint partner and the distal radial ulnar joint is the concave joint partner. So when moving with the convex joint partner, we will have to roll and glide into opposite directions. Now roll into palmar and increasingly proximal direction, and at the same time perform the glide by pulling the proximal intercarpal row into dorsal and increasingly distal direction. The distal component is added as the distal radial ulnar joint reaches slightly more distal on the dorsal side compared to the palmar side. An alternative is the push technique. For this technique, the patient assumes the same starting position, only now the forearm is brought into supination. Then fixate the patient's forearm with one hand and grab the patient's proximal intercarpal row from palmar and embrace the proximal intercarpals with your thumb and index finger on the dorsal side. Now roll into palmar and increasingly proximal direction, and at the same time perform the glide by pushing the proximal intercarpal row into dorsal and increasingly distal direction. For all techniques, assess for movement quality during roll and glide, possible pain provocation and end feel. For end feel assessment, roll and glide to end range, then assess if further gliding is possible or not. In a hypomobile joint, the glide is reduced relative to the roll component, so no further gliding is possible. If you feel that the end feel or movement quality is abnormal, you can directly move further from assessment to intervention, as the techniques are identical. When used as an intervention, make use of the Maitland grades of mobilization to dose your techniques according to your goals. Check the video in the top right corner to learn more about that. Okay, you've reached the end of this video. If you are curious about a more specific assessment and mobilization technique for the dorsal capsule of the radioscaphoid joint, click on the video right next to me. If you like this video, please click on the thumbs up button below and don't leave without subscribing to our channel if you haven't yet, and hit the bell icon in order not to miss any new videos. As always, this was Kai for Physiotutors. I'll see you in the next video. Bye.